Hello everyone and welcome to this audio podcast. This audio podcast as part of a Phantom edition. This audio podcast as part of a Labostix Machina. This audio podcast as part of a Vertex Relay. This audio podcast as part of the Abstrax, and this audio podcast as part of a Storm Labostix production. Today's audio podcast will look at an abstract from around 2022 where the original works was part of a collaborative effort from a part of a collaborative effort in regard to some original research sort of in sort of in around in around between 2019 and 2022, and where this abstract or the abstract was put forward for presentation within a particular remit, and this abstract looks at online education with allied health professionals or AHPs for healthcare and practice excellence, and looking at bridging gaps between pediatric and adult nephrology, between pediatric and adult nephrology. The abstract is as thus: so chronic kidney disease (CKD) is recognized sort of if recognized as a silent, irreversible, long-standing or long-term condition. CKD tends to establish or identify is identified as a health complication and a sort of and a or comorbidity. Patient access or recipient access to education support surrounding nephrology is already challenged owing to clinical environs, and the aims around this as part of this works was where the investigation sought to highlight the importance of involving both healthcare service users and healthcare professionals in context or allied health professionals (AHPs) in online consultations and or educational visits to improve healthcare practices. In regard to the objectives of the work, the investigation sought to ultimately understand if it would be advantageous to have follow-up online or remote educational consultations with a multidisciplinary team or MDT as part of routine nephrology appointments. In regard to the methodology, so members between two social media platforms were informed that topics would be tagged between social media platforms, one being for pediatrics and young people social media platform, and one being adult population, adult renal population social media platform, and a main feature would be pinned at the top of respective social media platforms. In regard to sort of the ethics of around this was GDPR, General Data Protection Regulation 2018 guidelines were applied to ensure no personal identifiable information is or was shared, and the analysis part of this was where topics were tagged for 2 weeks per social media platform. Topics were tagged for 2 weeks, 2 weeks per social media platform, and between the two international social media platforms, 14 themes had been identified and evidenced over a 1 month duration between March and April 2020, around March and April 2020, and highlighting the important where the themes have been identified and evidence over 1 month per social media platform, over 1 month during March and March 2020 and April 2020 in regard to the highlighting the importance of integrating education between a pediatric and adult online populations in regard to the sort of discussions and conclusions. The work sought to highlight or inform on how healthcare professionals and healthcare service providers and healthcare service users could be working together online to improve experience before routine appointments and depending on case scenarios. There is a requirement to review and integrate for chronic kidney disease healthcare or CKD healthcare and practice excellence. In regard to the conclusion, online spaces that streamline and integrate education to prompt or promote initiatives such as integrated care pathways, patient-centered care, and shared decision making are important examples of attempts to align clinical, non-clinical of attempts sorry to align clinical, non-clinical, and service user healthcare. In regard to in regard to a summary, an summary as part of this abstract, patient and public involvement initiatives or PPI initiatives are quintessential two aspects of integration. In regard to main sort of terminologies to identify similar works, include social media, technology, kidney care, patient and public involvement, and public health. That draws this audio podcast to a close. This audio podcast, as part of a fandom edition, this audio podcast, as part of a Labostix Machina, this audio podcast, as part of a Vertex Relay, this audio podcast, as part of the Abstrax, this audio podcast, as part of a Storm Labostix production.